हेलो फ्रेंड्स, वेलकम टू माय चैनल एएमएस एजुकेशन। आज हम देखेंगे साइकियाट्रिक एमसीक्यूज। सो हु इज नोन एज फादर ऑफ साइकोलॉजी? इट्स विलियम वुंड। द हायरार्की ऑफ नीड्स आर डिस्क्राइब्ड explained by Abraham Maslow. In Maslow's hierarchy of physiological needs, the human needs of greatest priority is A. Love, elimination, nutrition, D. Oxygen. Answer is oxygen. In Maslow's hierarchy human needs, the highest level of human need is safety and security, self-sacrifice, self-actualization, self-esteem. Answer is C, self-actualization. In one of the type of mental retardation, children are trainable, moderate, severe, profound, mild. So answer is A, moderate. The ectomorphic personality body type, which is the correct? Large, viscera, soft body, socialized, tall, thin and fragile, strong, muscular. Answer is tall, thin and fragile. Which is not a stage or process of memory. Retention, recall, encoding, reorganizing. Answer is reorganizing. When an individual is not able to decide among two equally important goals, it is referred as substitution, conflict, repression, projection. Answer is conflict. Repetition of similar actions in similar substances is definition of habit, attitude, emotion, motivation. Answer is habit. In which type of sleep most vivid dreams occur? Non-rapid eye movements, non-hibernation sleep, rapid eye movement sleep, hibernation sleep. Answer is rapid eye movement sleep. Psychosexual disorders in which sexual behavior is directed to animal. Fetishism, bestiality, frotteurism, transvestism. Answer is bestiality. Following psychiatric disorders are comparatively common in female, except bipolar disorder, transvestism, and Brexit nervosa social problem. Answer is transvestism. Situation in which individual experience symptoms and have excessive worry or belief that they are suffering from a physical illness despite lack of medical evidence is known as pain disorder, dissociative disorder, phobic disorder, somatoform disorder. Answer is somatoform disorder. Unwanted thoughts with repetitive ritual behavior refers to stress, phobia, OCD, anxiety. Answer is OCD. Problems like stealing, lying, gambling are classified as educational difficulties, antisocial, psychosomatic, bad habits. Answer is antisocial. Autism usually can be diagnosed when child is about 1 month, 2 months, 2 years, 14 years. Answer is 2 years. A woman diagnosed with terminal breast cancer discusses with her husband her wishes for end of life care, including her funeral. Which type of loss is this couple experiencing? Perceived loss, anticipatory loss, temporary loss, sudden loss. Answer is anticipatory loss. Kubler-Ross stages of dying does not include anger, acceptance, bargaining, refusal. Answer is refusal. The stages of Kubler-Ross theory includes denial, anger, bargaining, depression, and acceptance. Biochemical etiology of Alzheimer's disease relates to epinephrine, serotonin, dopamine, acetylcholine. Answer is acetylcholine. Which action from mental health team members would be appropriately while caring patient with paranoia? Increases specialization with other patients, avoid laughing or whispering in front of the patient, encouraging patient to attend group therapy, encouraging family members to be away from the patient. Answer is avoid laughing or whispering in front of the patient. An inflated sense of one's own importance is seen in which of these personality disorders? Antisocial personality, schizoid personality disorder, borderline personality disorder, narcissistic personality disorder. Answer is narcissistic personality disorder. All other features of mania except insomnia, pressure of speech, disorientation, grandeur delusion. Answer is disorientation. Which of the following describe the cognitive triad of depression? Helplessness, sleeplessness, worthlessness, thoughtlessness, worthlessness, sleeplessness, hopelessness, worthlessness, thoughtlessness, hopelessness, worthlessness, helplessness. Answer is hopelessness, worthlessness, helplessness. Eradication of unwanted habits by associating unpleasant conditions. It is called as aversion, desensitization, classical conditioning, biofeedback. Answer is aversion. Which of the following is an anti-craving drug? Disulfiram, acamprosate, chlordiazepoxide, diazepam. Answer is acamprosate. Vitamins are having all of the following actions except mood elevation, feeling of well-being, sedation, increased alertness. Answer is sedation. Benzodiazepine reduces anxiety by acting on which neurotransmitters? GABA, serotonin, noradrenaline, dopamine. Answer is GABA. Which of the following is not a mood stabilizing agent? Fluoxetine, lithium carbonate, valproxide, clonazepam. Answer is clonazepam. Parrot-like or pathological repetition of words spoken by person is known as echolalia, neologism, echopraxia, dyscalculia. Answer is echolalia. What is meant by thought broadcasting? Delusion that one's thoughts are being controlled by others, experience of thought being removed from one's mind, unpleasant expression of thoughts, delusion that one's thought can be heard by others. Answer is delusion that one's thought can be heard by others. The identification and interpretation of sensory input is cognition, affect, perception, judgment. Answer is perception. Police arrives at emergency department with a client who has lacerated with both ribs, which is the initial nursing action. Administer an anti-anxiety agent, assess and treat the wound sites, secure and record a detailed history, encourage and assess the client to ventilate feeling. Answer is assess and treat the wound site. During ECT, the client receives oxygen by mask via positive pressure ventilation. The nurse assisting with this procedure knows that positive pressure ventilation is necessary because seizure activity depresses respiration, muscle relaxants given to prevent injury depress the respiration, anesthesia is routinely administered during ECT, decreased oxygen to brain increases confusion and disorientation. Answer is muscle relaxants given to prevent injury depress the respiration. The nurse is teaching a client who is being started on imipramine over the medication. The nurse should inform the client to expect maximum desired effects at which time period following initiation of the medication. In 2 months, 2 to 3 weeks, during the first week, during the 6th week. Answer in 2 to 3 weeks. False perception with stimuli is known as mania, delusion, hallucination, illusion. Answer is illusion. Anxiety is caused by an objective threat, subjective perceived threat, hostility turned to self, masked depression. Answer is subjective perceived threat. Gender identity is the individual's sexual behavior, sexual orientation, sense of being feminine and masculine, sense of preferring one sex over the other. Answer is sense of being feminine and masculine. Which type of this memory is intact in individual who is able to recall multiplication table that learned from the school? Semantic memory, episodic memory, working memory, procedural memory. Answer is semantic memory. Question 44. Dash is the procedure of artificial induction of grand mal seizure through the application of electrical current to the brain. Transcranial magnetic stimulation, reflexology, phototherapy, ECT. Answer is ECT. Drop-in sulfate is administered before ECT as a short-acting anesthetic to relax muscle, to reduce secretion, to induce sedation. Answer is to reduce secretion. Which of the following drugs is neuroleptic? Imipramine, Librium, clonazepam, clozapine. Answer is clozapine. Major side effects of antipsychotics: drowsiness, dry mouth, EPS, anorexia. Answer is extrapyramidal reactions. Life-threatening side effects like agranulocytosis seen during use of haloperidol, olanzapine, clozapine, MOIs. Answer is clozapine. Tyramine reaction can be seen when patients take combination of SSRI with lithium, MOI with lactose, alcohol with opioids, MOI with cheese. Answer is MOI with cheese. DOC in OCD. Cognitive behavior therapy, haloperidol, fluoxetine, Librium. Answer is fluoxetine. During ECT, current passed is about 5 to 10 seconds, 10 to 30 seconds, 0.3 to 0.7 seconds, 1 to 3 seconds. Answer is 0.3 to 0.7 seconds. Common side effects of ECT is impairment of judgment, speech, thought, memory. Answer is memory. Indication for primary use of ECT is non-compliance with treatment, major depression with psychotic features, severe agitation, antisocial behavior. Answer is major depression with psychotic feature. Which electrolyte level should be checked by the nurse before administration of lithium to a patient with manic episodes? Potassium, calcium, sodium, chloride. Answer is sodium. Function of gland which is affected in lithium toxicity is parathyroid, pituitary, adrenal, thyroid. Answer is thyroid. Which of the following body organ remains unaffected with side effects of lithium? Kidney, liver, fetus, heart. Answer is liver. Association of hypochondrial delusion and nihilistic delusion with depressive psychosis in the elderly is called as Cotard syndrome, Cancer syndrome, Landau-Kleffner syndrome, Korsakoff syndrome. Answer is Cotard syndrome.